It was hard for me to learn that I don't get to set what the objective is, what the end game is.
I might have my knowledge,
Mhm.
but I'm not the expert of you.
Yeah.
I am not the
Mhm.
expert of you,
Mhm.
and you need to teach me,
Mhm. Mhm.
who are you?
I ask people, if I had a magic wand for your life, what would be the thing that I could pull that magic wand out and fix today? And then you would think that everything was perfect.
Should we not acknowledge that there is anxiety that lives in my
Mhm.
life, right?
Mhm.
Or in my head?
Mhm.
Yes. I am not saying don't identify that, but anxiety to me or depression to me is like the unwanted guest.
Hey everyone, welcome to Conversations with New Beginnings. My name is Teray, and I'm so glad that you're here. This podcast is about meaningful conversations that uplift, empower, and inspire transformation. Before we begin, please help us by taking a quick pre-survey. Your perspective helps us shape conversations that truly uplift, empower, and inspire transformation. Also, wait till the end for another quick message from me. I hope you enjoy this episode.
Hi, I'm Cheryl Chambers, licensed clinical social worker from New Beginnings Family Services, and this is Conversations with New Beginnings. And I have here with me today Erica Daniel from A Peaceful Place Integrated Care. And I am just pleased to have you here with me.
Well, thank you.
But introduce yourself. Tell
Okay.
us about who you are, what you do, and so we can just keep it going.
Okay, sure. So I'm Erica Taylor Daniel. I am a nurse practitioner. I am certified both as family practice and mental health, mental health across the lifespan. I do own Peaceful Place Integrated Care in
Yes.
Dover, where we provide holistic care to the whole person across the spectrum of what it is that they may need. So primary care, mental health care, medicated assisted treatment. We do offer some amount of psychotherapy. We try to meet our patients exactly where it is that they are and bring them to where it is they want to go.
Oh, I love it. I love it. And we do a lot of referrals, New
Hmm.
Beginnings and A Peaceful Place
Yes.
work together. I love the philosophy, especially meeting a person where they are, being able, that's one of the core of social work, the core foundations, the underpinning is person and environment, meeting that individual where they are and helping them get where they want to be instead of us
Hmm.
making that decision on where they need to go.
And that's really the tricky part is, it's so hard. It was hard for me to learn that I don't get to set what the objective is, what the end game
Mhm.
is. This person gets to set what success looks like to them, what finished look like to them. All of those things are on their terms. It was hard to come to when you're
It
thinking,
is because you wanna
yeah,
help,
yeah,
right?
you want to help.
"Oh, I'm
Yeah.
here, I got my cape on,
Hmm.
and I just wanna help,
Hmm.
and this is what I know.
Yeah.
This is it almost like I know better than you."
Absolutely, and that's a tough spot to pull back from, to learn to pull back from.
It is,
Mhm.
but, with us doing this podcast, one of the things that I wanted to get out of this was to really put the humanity
Mm.
back in the person,
Mhm.
to allow them to reclaim their story,
Mhm.
reclaim their narrative, and how do we provide that additional support to them? And so I really am thankful. I'm really privileged to have you here because I wanted we've had so many deep conversations
Yes.
about this, but, I don't want to keep talking about it. I want to hear from you in like, what was your journey? Like, what do you do right now that really makes an impact? Do you think that makes an impact on keeping that individual in that space of responsibility? It's like it's on you. I'm here for the journey with you,
Mhm.
but what do we need to do? What do we need to do to get that back to them?
I honestly think the way we met is one of the biggest things that I try to do, which is vet out the people that I send my patients to. So I'm
Mm,
not looking to re-traumatize. If there's a service that I don't provide and I need to find somebody else, I'm going to make that referral to a person that I know is like-minded.
right,
So
right.
I'm not sending them out to essentially somebody that I haven't met or they haven't met, to just take a chance. The
Yeah.
vulnerability that our patients express or display when it's time to tell this story again is immense. And the last thing I want to do is have them be re-victimized by somebody who points fingers or blames.
Oh, yeah,
So
yeah,
the just being completely careful with what that experience looks like both within and without. So that's making sure our front office staff is aware of proper use of pronouns, letting
yeah,
people identify the way they choose to identify, not asking for more information than they need for the service that they provide. So
exactly.
it's not you're on the phone, I take this much of a drug and I need to do this. No, it's just I just need a little bit of help, or
Mhm.
this is just the place that we need to make your appointment. But beyond that, you'll share that with the provider as necessary. So it,
Exactly.
it really is listening more than you talk
Mhm.
so that people can tell you what it is that they think they need. I offer, occasional suggestions. If you're going to try this, have you thought about that? But I take a no as a no. When the
Exactly.
answer is no, it's no. It's not, well, you should. There is no should in this with somebody else.
Yeah, yeah,
Mhm,
and that is so important, is to allow that client to feel like they're in the driver's seat,
mhm,
especially in this day and time in which a lot of times they're coming to us so vulnerable in
mhm,
such a broken space.
mhm,
And so I think that becomes that step one
mhm,
is empowering them. No, this is your care.
mhm,
I'm here for the journey. And I know even here at New Beginnings, we do a lot of that. What do you want?
mhm,
What do you want to
mhm,
see? What is it that you would like from us?
mhm,
We're here to take the ride along with you. Going back to the referrals and being able to make sure that we do a warm handoff.
mhm,
And I know we do that a lot
mhm.
with because your Joan and my Jane communicate a lot.
Yes.
And I'm listening to,
Mhm,
and they have that exchange and making sure that services, they don't fall between the
mhm,
cracks, right?
mhm,
Like, no, we're going to do a warm handoff. We're going to keep, because matter of fact, I was talking to Jane the other day and she was like, oh no, Joan and I talk, at least once a week to make
mhm,
sure that the referral process,
mhm,
because
mhm.
that's a big thing, because they can get lost from Dover to
Absolutely.
Milford. Somehow, if some way they can get lost.
Mhm,
But if they have that Joan or Jane to come in to say, oh no, honey, we got you. You got this appointment here
mhm,
and we're sending off over all the information
mhm.
so they don't have to come in here and tell their story all over again.
Absolutely. And it's so much that we have to be aware of that we take for granted that people know that they don't.
Mm,
You always think to yourself, you don't know what somebody doesn't know. So I start pretty much every conversation once they've gotten to me with, I'm going to tell you everything. If at some point you want me to be quiet, say, hey, I know, right?
yeah.
I'm not talking down to you. I'm afraid I'm going to miss something that you don't know. There are a million things I don't know. I
Exactly.
had to put
Yes.
air in my own tire a couple of weeks ago, and
Mm.
I didn't know that the plus and the minus did something on the button, right? And I'm just pushing the button,
Hmm.
and air was coming out of my tire, and so I'm calling home. I'm like, "Hey, air's not going in; it's coming out," and I didn't know. And you don't know what somebody doesn't know.
But isn't it interesting that they always want to put us in that seat, because we have these practices,
Mhm,
because we're here and they want to put us in the seat of, oh no, you're the expert. I
mhm,
might be, I might have my knowledge,
mhm.
but I'm not the expert of you.
That's exactly what I
Right?
say. Yep.
I am not the expert of you,
Mhm,
and you need to teach me,
mhm,
who you are.
mhm,
Who are you? So many times ask my clients, I'm like, what is it like to be you?
mhm,
Tell me what that looks like. Tell me what it feels like. Help me understand. You have all the pieces of the puzzle.
mhm,
I'm just here to help you sort it out.
mhm,
Empowering that individual to recognize that they are human beings sitting across from me.
mhm,
And you might perceive I'm the expert,
mhm.
but honey, I just had to figure out how to put air in my own tire,
Right, right.
right?
And so I try to share a lot of those stories too, though.
Oh,
Look,
yes.
I by no stretch of imagination have it all figured out. I'm trying to do the same things you're trying to do. May look a little bit different, but we all have something. You don't know what that person doesn't know. Knowledge is also just inferred. So the things that I do
Mm,
know, somebody taught me just before you. So I can teach you too, and now you know too. So it's
exactly.
not some secret vault that only certain people get into. It's opportunity, it's exposure, it's willingness. You have those things, and we can do those things together. What you don't
Exactly.
want to know, I will never want to know anything about fishing. I don't want to. I don't want to fish. I don't care about it. So if I were in a space where you decided that fishing were a priority, I'm not coming back. What are we going to talk about that for? It's not going to help me.
Yeah.
So I ask people, if I had a magic wand for your life, what would be
Mhm.
the thing that I could pull that magic wand out and fix today? And then you would think that everything was perfect. So let's
Wow.
start on that thing. So the thing that you either can't tolerate being this way a minute more, or the thing that you wish you didn't have to do the work to fix, what is that? And let's decide how we want to make that work.
I love that because that really does challenges them to look within, right?
Mm-hmm.
To say, and how many people like they go to the doctor, right?
Mm-hmm.
Does any doctor ever ask, what is it that you want fixed? Right? We're
Right.
always being told,
Right.
oh, this, your high blood pressure,
Mm-hmm.
this diabetes,
Mm-hmm.
this is what you have to do. Everyone is being told what is broken.
Mm-hmm.
Whereas in our field, it's not just about what we see, but what is it like to be you,
Mm-hmm.
and how would you like to proceed as we move forward?
Mm-hmm.
And really, what we're doing is putting them back in that driver's seat, because I don't need to be the driver of your life and my life too.
Absolutely.
Right? Like
Absolutely.
I believe in we
Mm-hmm.
work our way out of a job.
And I'm not, that's the goal. And that was really what
Yes.
absolutely made me love you when we had that first conversation. You said, I want to work my way out of a job. I always say, this is not a lifestyle, right? I'm not trying to give you a new crutch. I don't want to trade. I want you to
Mhm.
learn the skill that you need to do what it is that you want to do to put you where you want to be. I want you not to need to see me every month. How do we make this
Yes.
every 3 months, twice a year? The intention is not medicine forever. The intention is, how do I fix either issue that's happening right now that
Mhm.
medicine will support while you do the bigger work of psychotherapy? I always tell my patients, psychotherapy plays an amazing role in what it is that needs to be done. Medication provides some support to make this tolerable while you do the hard work.
Yes. Oh my gosh,
Unless
yes.
it's, we have a biochemical disorder. If that's
Right,
the case,
right.
then we have to do something
Everybody can't
different.
be
Yeah,
off meds. We don't
everybody.
want everybody
Yeah,
off. But
everybody
the
can't be.
ones that, you find yourself in this season where,
Mm-hmm.
I need a little bit of I need a little bit of help. I need
Mm-hmm.
a little bit of, just to get me, but come on, don't
Mm-hmm.
forget that you got to do the work.
Mm-hmm.
It infuriates me that sometimes we get clients in here, "Oh, how long you been on, you know,
Wellbutrin, that's my favorite people on it
right?"
for.
Or no, for me, it's the anti-anxiety. It's the
Yes,
Xanax.
that's an
Like,
advance,
how
yep.
you been on Xanax for 20 years and you
Mhm,
never develop a skill
mhm,
to manage the anxiety?
mhm, mhm,
And then my biggest is, oh, my anxiety
mhm.
or my depression. Why are we owning
Right,
this thing,
right, right,
right?
right.
Why are we taking on?
Mhm,
Don't get me wrong. Should we not acknowledge that there is anxiety that lives in my
mhm,
life,
mhm,
right? Or in my head?
mhm,
Yes.
mhm,
I am not saying don't identify that, but anxiety to me or depression to me is like the unwanted guest that
mhm,
constantly hasn't left yet.
mhm, mm.
Like I'm ready for you to go.
Right, right,
I'm not wanting you to. I'm not gonna let you just keep holding up space in my life,
right. And
right?
the eviction process exists for a reason. So you have to kind of put it together. Right? Like, you can
Yes.
let somebody live rent free for only a certain amount of time before it takes a toll on you too.
But yet you come in and you're
Mhm,
like, my anxiety, my anxiety.
mhm,
How
mhm,
long do we keep complaining
mhm, mhm,
before we do the eviction process?
mhm,
And what does that look like,
mhm,
right?
mhm.
Like, hey, medicine is only going to help smooth out the symptoms.
Absolutely.
But what is the work that needs to be
But
done?
I think from a medicine prescriber standpoint, a lot of that is the explanation. So
Yeah.
we're explaining, how is this working? What exactly is happening? How do the medicines fill in? And your body can do this. It is simply a
Yes.
hijacking of a different system that we need to put back, right? We had a trauma. We didn't learn a skill set. whatever the origin of it exists. But once we acknowledge what that is, we can reteach. So I say that all the time. These are very much teachable skills. This is
Mhm.
a skill set deficit. We can work through that skill set and, move our way through. So I think it's really about having those conversations and giving people back the power, as opposed to them thinking, well, this is my diagnosis and I have it forever.
Mhm.
Being dual certified family and mental health, I end up with people with medical issues that do them the same, right? And I'm saying,
Yes,
that
yes.
A1C is absolutely
Mo
flexible.
Right,
Yeah,
it's movable, right?
yeah, it
We
does
don't
not have to stay at 13 forever.
Mhm.
You make some changes, do some different things, then that's going to go down. Well, let's look at that the same with our GAD-7, our PHQ-9, whatever screening tool we're doing for anxiety, depression, whatever other mental health manifestation there is. We should be able to see those skills and those scores change. They
Yes.
aren't meant to be there forever.
And so, oh, I love that. I will say that what we had to really, what I hone in here at New Beginnings is that you've got to rule out medical
Mhm,
before you rule in
mhm,
mental health.
mhm,
And so a lot of times individuals coming in with depression and things like that, we what's going on with your D3 levels?
mhm,
What's going on with your thyroid? Have you been,
mhm,
so you have all these other aspects that we've got to get addressed.
mhm,
So I do love that. And I love that because we work together very well
mhm,
when it comes to that. What's going on medically with them?
mhm,
Because a lot of times I'll go and send them back to their primary
mhm.
and say, hey, you might need to look at these. What's the blood work look like
Right,
here? And they're like, why?
right.
Right? Or I don't understand what you're looking for.
Yeah.
So I love that. But as we transition,
Mhm.
so one of the things that I loved, you started, I don't know, a couple of years ago with the medication to help me. What was the
So
name?
it's medicated assisted treatment. So where we
Yes.
use buprenorphine, which the brand names Suboxone, Subutex, Brixadi, Sublocade, and we also use now Trexone for alcohol use disorder or opiate use disorder. We use all of the FDA approved modalities and some FDA off label modalities for stimulant use disorder and other things that are yet to have an approved treatment plan.
Oh, wow.
But I think recovery, the most important thing we do there is still the same conversation we have with mental health. This is a process.
Yes.
And
And it's not meant to sit on methadone.
forever.
Right? And
Nope.
methadone has really had, because I can remember starting out back in the early 2000s, right?
Mhm,
And it wasn't always something that you're going to stay on, right?
mhm,
But
mhm,
then somehow, some way, it became this whole huge industry,
mhm.
right?
It is, it is.
And where we've got people going in
Mhm,
droves,
mhm,
3 o'clock in the morning,
mhm,
and I actually got fired, honestly, from a provider, where they just stopped referring people to me
mm,
because from the beginning, when you come to me and
mhm,
because what's frustrating is that in the state of Delaware, in order to be on methadone or Suboxone, you have to have 1 hour substance abuse therapy,
yes.
right?
Mhm,
And so they would come and meet with me
mhm,
for that first intake,
mhm.
and I'm already starting a treatment plan, which
As
is
you should.
what? What's the question?
Discharge, what does that look?
Discharge. What
Mhm,
does discharge look like?
mhm,
What and discharge means if we're going to discharge,
mhm,
then we're looking at what does your titration look like?
mhm,
What do
mhm,
you prefer to be blind? Do you want to
mhm,
know
mhm,
where are you at and how do we start to
mhm,
work on that?
mhm,
But what I found was that a lot of providers didn't want to hear that.
mhm, mhm.
And I got fired because it was like I was sending them back with this whole ideal that we're ready. We're going to work on this, whether it's 12 months, 6 months, however,
Mhm,
this discharge plan, because Suboxone, methadone isn't meant for you to stay
right.
on.
I
At
think
least that's what I thought.
it's another one of those places where we somehow try to treat it differently than we do chronic medical issues. If you go into a hospital, you get admitted to a hospital, discharge planning starts when you get there, right? We need
Yes.
to know what the issues and concerns are and what it is that you would need to be successful beyond this hospitalization stay. Additionally, readmissions are frowned upon, right? So to come back into a hospital with the same medical diagnosis within 30 days, everybody's looking at that. But why don't we look at
Yeah.
that the same way from a mental health perspective? It's not something that we look at that way. We just get people in and think we're going to hold them forever. But I think that's another piece of the paternalistic, I know better than you do, and you're going to stay right here. I think another place that we have a huge deficit in that is treating the underlying mental health illness. Nobody
Yes.
wakes up, or at least I haven't met the person who woke up and said, "Hey, I just want to be a drug addict," right? People
Yes.
wake up and say, "This doesn't feel good. I don't know how to deal with this thing, and I just want to not deal with it." So a substance, fills in a gap there really, really nicely. So the ability to get somebody in there that can either treat medically and do the psychotherapy piece that allows people to deal with what the underlying issue is, I think, the part that's missing. So when people discourage discharge or looking at how we get out, I think it's a concern of whether or not the overarching issue is going to be addressed in a way
Yeah.
that is healed enough for people to go on. I know when we do an admission and we're talking about discharge planning, I probably never address a withdrawal from the medication. I reassure them that they'll never just show up one day and it's gone,
Right.
but we
Right.
have to have a plan as to how we're going to deal with unemployment, transportation,
Mm.
interpersonal relationship issues, self-esteem, all of those things. And as we get those things together, then we can start looking at this.
Exactly, and, some aren't ready, and
Mhm.
I
Mhm.
should have some aren't, they're like, "Wait a minute," because, of
Mhm.
course, what is really happening? They don't
Mhm.
want to deal with that withdrawal, and
Mhm.
some may feel that, "You know what? This is keeping me clean."
Mhm.
Don't wanna break
Mhm.
what's
Mhm.
been fixed by
Mhm.
this right now, so
Mhm.
you're absolutely right. Let's start looking at the other disparities and the other things that they need to address, and hopefully, but we ultimately still need to be working our way out of that job in one
Mhm.
way and eventually broach it later on to see if, where you're at now.
Mhm.
How are you feeling?
Mhm.
You've got the job, you've got the stability. We're
Yes.
starting to work on the
Mhm.
issues that even caused,
Mhm.
you to get here.
Mhm.
Then where are you at?
And then
But
you
you're
have
so
people
right.
who have had so many false starts. They're
Mm,
afraid of the new start. Like, how long is this going to take? You know what I mean? Is somebody going to pull the rug out from under me again?
yeah.
How did I get here again? And so I think you're really right in working on those relationships and interpersonal skills. How do you make real boundaries? How are you not doing the same things, accepting behaviors that put you in a place that was uncomfortable, unmanageable, and then you were back to what feels good?
Yeah.
Everybody goes home at some point to the thing that feels
Yes.
right. So how do we fix what home is, what it looks like, what you
And how
expect?
And how do we learn to be uncomfortable?
Mhm.
Because that's the thing
Mm.
I find is that nervousness that
Mhm.
people are feeling,
Mhm.
it's nothing bad to be
Mhm.
nervous.
Mhm.
It really is it's something that it's something different that you're being exposed to
Mhm.
that you
Mhm.
don't know.
Mhm.
And like you said in the beginning, you don't know what you don't know, but it doesn't mean that we don't venture in that area,
Mhm.
right? You don't know what it's going to look like to titrate off of off of methadone,
Mhm.
but at the same time, let's walk together
But
and
we
let's
also
figure it.
have to know that you don't know, and maybe the people you surround yourself with, because they don't want you
Mm,
off, intentionally tell you this is the worst thing in the world, right? So we have no idea where they're coming in from and what their life experience or what's being reported to them. When this is who you've surrounded yourself with and these are the people that you know, then you only know and have seen what's in your field of vision.
Yeah.
So
Yes,
the
that's a hard
idea,
one.
yeah, so I think that's why these moments are important, where people get an opportunity to talk about what true and maintained recovery looks like.
Yeah.
I think we don't do enough to showcase people who have had long and sustained recoveries, and so that people can see that it can be done.
Right, right.
Mhm.
And again, this is not a podcast that's anti, you
Right,
know, treatment,
right.
or anti methadone or Suboxone,
Mhm,
but it's a podcast that really wants to kind of let's talk about
mhm,
both sides.
mhm,
So with that being said, let's talk about the stigma on the people who choose
mhm,
to have alternative treatment,
mhm,
right?
mhm,
And may not even choose to go to therapy unless
mhm,
it's the basics.
mhm,
And let's talk about the stigma of even choosing that or not. Like,
mhm, mhm.
can we talk about that? What does that
Sure.
look like? And how do they do in the shame and guilt that
Mhm,
might come from
mhm.
all of that?
So we try to spend a lot of time saying there is no right way. It is simply the right way that works for you. Everybody has their quirks, their habits. I share mine. There's no chance I'm ever going to eat salad with a fork. It's disgusting. But if I eat it with my fingers, it's great. I don't know
Yeah.
why, but that's what I'm going to do, and I'm allowed.
Hmm.
So that's the same for
Yes.
you in this setting. We're going to do them a la carte if we need to. If the most important part for you with that magic wand is not using, you can deal with the therapy piece later. I'm going to always encourage it. I'm
Right.
going to throw in whatever it is I can in
Mhm.
the time that we do a medication conversation, and we're going to have that
Because we're
conversation.
gonna put some good stuff. You just
Yeah,
can't have lettuce,
yeah,
right? We
right,
need some
right.
cucumbers in
You
there. We
have
need
to. You have
possible
to.
protein every now and then.
Mm-hmm.
I'm gonna
Mm-hmm.
put it up there,
Mm-hmm.
right? But at the same time, I'm only you can if you could. This is what you can take,
Mm-hmm.
and this is what you can tolerate. We're
Mm-hmm.
gonna still walk this journey
And I'm
together.
not going to tell you that you're not welcome here because you have to have a fork.
Yeah.
If you don't have a
Yeah.
fork, like we may find a million other ways around it. Maybe you like chopsticks. I don't know. But
Yeah.
that's going to be
Yeah.
open. And I'm going to try to have as much of those things as possible and ask you what feels good to you. Now, certainly as people who are licensed by the state, there are requirements. There are things that are completely not ethical, legal, any of those things. We have to function within the scope of our practice and within the boundaries of what we're allowed to do by the state. But beyond that, we can try anything. So I like to say as a theory in our practice, my goal is to give as many yeses as I possibly can.
Yeah.
Help
Yeah.
me find my way to yes in this. So you have a dose that's a little bit different than somebody else's. Then maybe we can only do that 3 days at a time. Right? We'll do that
Yeah.
3 days at a time. We'll see how that works. We'll adjust. We're not going to be able to do anything additional to that. Let's see how it works.
How do you address or how do you approach individuals that might be, drug seeking?
Mhm.
Because it's
Mhm. Mhm.
and I hate to
Mhm.
to put it out there, but
Mhm.
let's talk about that because that's how do I support you
Mhm.
at the same time, but also protect you as well as protect my practice?
So for me,
Like the positive drug screens
mhm.
with the
Mhm.
with the with the methadone, right?
So we start our very first conversation with there's no right or wrong answer, just truth or lies, right?
Mm.
So you can say to me, you doing a urine drug screen, and no stretch of the imagination is a punitive tool for me. It helps me know what I need to do.
Right.
Because there are not any FDA approved medications for, let's say, stimulant use disorder, if I see a methamphetamine with somebody who's on Suboxone, why would I put you out the door for that? This Suboxone doesn't do anything about that. So let's look at some off label uses of some things that we can try. I'm certainly going to have a conversation. I did see it. This is exactly what I'm supposed to see, and we should have a conversation. The goal is harm reduction. How do we use less?
Yes.
If this Suboxone is absolutely keeping you opiate free, but it's not doing anything with stimulants, then I'm not going to
Let's
cut it
not
off.
right.
Yeah,
Let's
yeah,
not penalize
yeah.
from a user from being a user,
Right.
right? Like,
And that's where we find ourselves. And so that's where we start. Our goal is always a little bit less, a little bit less.
yeah,
So everybody measures, let's say, stimulants in a different way. For powder cocaine, most people tell me prices. So if you were using $20 a week when I first met you, and now you're down to 17 and 17.50, we won a little bit, right?
Yeah.
And so I need to praise that change, and we keep going. Our goal next time is 16.75. Like we're going to keep going
Yes.
in a
Yeah.
direction that validates that you're trying and that I can work with you. Now, when we have people who have amazingly unsustainable dosing of things that either they were getting illicitly off the street, or unfortunately, I'll find people who've come from other prescribers who have since either been disciplined in or some way, or they left that state. It really depends on what it is. It is an absolute case by case setting,
Yes.
but there's a contract and there's an explanation of what my legal responsibilities and liabilities are, and that I have to be very careful about what those things are. I'll meet you up until that limit. And beyond that, I can't be helpful. We recommend an inpatient detox if that's
Yes.
possible,
Yeah.
so that they can get supported through the most uncomfortable portions. For people who can't do that, then certainly there are medications that will support the symptoms that we're willing to prescribe to get you comfortably through coming down to a more reasonable dose of something. But it really is so individualized. I hope, I pray that's the intention, and asking people why they're using whatever this substance is.
Yes.
Untreated ADHD is a screamer for methamphetamine, cocaine, and alcohol,
Wow.
just the way they work, right? And
Right.
so it's an
Because we're
opportunity.
about we're going to self-medicate, right?
Because
And
they're going to self-medicate. So the example I always use: if you fell and broke your leg in the woods, you would find a stick and a vine and tie it there and make it work. Well, their stick and a vine may be methamphetamine, right?
right,
It's not what
right.
I would pick. It's not what I would do. But again, I'm not the person who's broken in the woods.
Yes, that is so true. Now, what do you do
Mhm.
for family members who criticize, right? So we've got the stigma
Mm.
of
Mhm.
the
Mhm.
person who's struggling, who's
Mhm.
trying to get to, because the ultimate goal is to get to recovery.
Mhm.
But then we have, and so if they're with you, then they're
Mhm.
trying to work on a recovery
Mhm.
plan, right?
Mhm.
But then you've got a family member or family members who disagree with all these approaches.
Right, right.
Like, have you ever had to deal with that?
Absolutely, absolutely. And I tell the patient, one, my shoulders are strong, so I am not related to your family member, right?
Mhm.
So if you have signed an ROI and I can have a conversation with this person, then I'm more than willing to have this conversation. If there is not a release of information, I'm not having any conversation. So they have power in that.
Right,
If somebody has signed that release and they want me to have a conversation, I will have that conversation. But that's very similar to the conversations I used to have when I was a hospice nurse. There was always a family member or a pastor who wanted to come in and tell me that I was trying to kill people. No,
right,
you pull out your Bible, I'll pull out mine. We'll go verse for verse, right? And that's
right,
the
right,
same thing. I'm going to be able to pull out what science shows us, what studies have shown us. So the usual statement I get is, well, you just traded one thing that they're addicted to
yes.
for another.
Mhm.
But I gave them something that is not associated with illness, arrest, or negative outcomes. We don't say that at all about insulin, which is absolutely a trade. When your body stops making insulin, we don't say, oh, you're going to die now. We give you
Right,
insulin, right? Like
right,
we do
right,
all of the things
right,
that are required to treat a person who's a diabetic. So why is it with a mental health disorder, I'm not allowed to give you the treatment? Because it's a trade. So when you're willing to give up your blood pressure meds, your insulin, you're willing to give up whatever, you don't ask me for an antibiotic, because why isn't your immune system doing what it needs to do?
right,
Get your
right.
white cells, right? Like, so we're going to have that argument on every page. Some people are very much just kind of stuck, but usually I'll say, let's do some small incremental measuring, right?
Okay,
So if you give your daughter a month on this, what do you want to see happen in a month? And in that month, if we've accomplished that, then we'll keep going. And
right,
so usually people just need, as long as, again, that relationship was a positive one to start with. Some people you're never going to be able to make happy because they don't want this person to stop using, right?
Or they're blaming, they're
Mhm.
not dealing with the pain, they're
Mhm.
not dealing with the frustration or the fear,
Mhm.
right?
Mhm.
And they're wanting to
Mhm.
blame something.
Mhm.
And
Mhm.
I think a lot of times if they're not blaming their loved one, then they're blaming the providers that are there.
Absolutely.
So, with this being said,
Mhm.
in a perfect world,
Mhm.
you've got the magic wand, right?
Mhm. Mhm.
And you get to sprinkle the pixie dust all
Mhm.
over.
Mhm.
What would be the thing that you would want for individuals with this living through this lived experience? Like, how do we destigmatize and create a safe space for them to approach recovery,
Mhm.
to just find their humanity?
Mhm.
What needs to happen besides,
The
so you
answer that's
sprinkle.
in my mind is probably not even in this section. It's building stronger children.
Mm.
It's not stigmatizing, blaming, abusing small people for making mistakes.
Oh,
There's never a time that I've done a history where somebody said to me, I felt just fine as a child. And I'm a mother. So I know that there are things that my children will say that I did wrong. So there's nobody who wakes up and says, oh, what can I do to screw my kid up? But it is absolutely being aware that somewhere in there you zigged where you should have zagged, or
yeah.
that child needed something different. And we have to acknowledge it. We can't
Yeah.
say,
Yeah.
I raised 5 kids and everybody's fine but you, because all that does is further stigmatize or blame that person. So I guess if I really had a magic wand, it would be different parenting, different school screenings for developmental issues and concerns
Mhm.
earlier, not stigmatizing the one that reads later, not stigmatizing like what all of the other things. Now skipping to actually the world that I'm in, what I would want is true parity in mental health, substance use, and medical. I use as many examples between mental health, substance use, and medical illnesses because I want everybody to see them as all the same. They're all
Yes.
biological.
Yes.
There is a causal etiology, there is a treatment. We should be following what the standardized treatment plans are for those things, not making them up off of what my gut tells me and what I don't feel is true. We should be looking to science that has absolutely substantiated that substance use disorder of all kinds are not a choice. It's not somebody choosing to not fulfill family obligations, and once somebody's in that loop, it is desperately hard to get out without assistive care, supportive care, and the ability to even relapse and still come back home.
Right, right. I love that. I you brought something up. I know we gotta close, but
Mhm,
addiction.
mhm,
We focus on substance use
mhm,
and we picture the people outside, we picture, the thefts, we picture all these things when we talk about people using,
mhm,
right? But yet I think what bothers me is that we don't see addiction across the board. The food addiction,
absolutely.
the
Mm.
porn,
The
the
shopping,
the
the
shopping,
working.
the working, the
Mhm,
overspending, right?
mhm,
Living beyond the
mhm,
addiction to chaos.
mhm,
There's a lot of
mhm,
addiction, but
mhm,
yet we want to stigmatize only this subset.
mhm,
But the reality is that how if you look at addiction across the board in your brain,
mhm.
isn't it kind of like all.
It is absolutely the same process. And what I try to explain whenever I teach this, it is the same process that is meant to teach us to do anything.
Mm,
So there's an initial use or behavior that then gets mapped in your brain as this worked well. And so your brain says, when
desired
I do
outcome.
this, this
Mhm.
works. When I do this, this works. It's a genuine certifiable system that we know is there and has been
Exactly.
validated, and it just got hijacked. We have to fix it.
Well, thank you for coming.
Thank you
I
for talking
love
with
it. I
me.
love it. And hopefully we can take this journey a little further and just
Sure.
talk about all the aspects, kind of take that telephone call and share it with everyone else. But
Yeah.
thank you for being here.
You're very welcome. I'm
All
glad to
right.
be able to come.
Hey y'all, it's Teray again. Now you've heard the conversation. Now we want to hear from you. Take a moment to click the link in the description to our post survey so you can share what stood out to you, what challenged you, and what inspired you. Always remember to like, comment, and subscribe. And remember that one conversation can spark a new beginning. Bye.